Hello everyone, you're welcome to another episode of How to Get Pregnant and Have a Baby. My name is Dr. Babatunde Okewale. I am the MD CEO of St. Ives Healthcare Organization. I am an obstetrician and gynecologist. I'm also a fertility expert. Today we will be talking about recurrent miscarriage or recurrent pregnancy loss. Now, a miscarriage is defined as the spontaneous loss of any pregnancy before the age of viability. The age of viability varies from country to country, depending on their pediatric or neonatal services. But generally speaking, we pick 24 weeks as the age of viability. So what that means is any pregnancy that is lost before 24 weeks is called a miscarriage. Recurrent miscarriage is defined as the loss of 3 or more consecutive pregnancy before the age of viability. The key word there is consecutive. If you lose a pregnancy or you have a miscarriage in this pregnancy and you subsequently have 2 normal babies and then you have another miscarriage, that cannot be termed a recurrent miscarriage. So it has to be consecutive on 3 occasions. Whenever it happens, the question usually arises, what could be the cause? The loss of pregnancy at any stage in pregnancy is usually a very distressing situation. So when you're looking at the cause of recurrent miscarriage, you are basically looking at 3 aspects. You are looking at the mother that is carrying the fetus, you are looking at the womb that is housing the fetus, and you are also looking at the womb itself. Could the cause be from any of those 3 things? So as I talk to you about the various causes, you can relate to those 3 aspects that I've spoken about. One of the commonest causes of miscarriage or recurrent miscarriage is age, the maternal age. It is generally known that as a woman grows older, the quality and the quantity of her egg starts to decrease. And also the incidence of miscarriage starts to increase. Part of the reason for that is there is an increased risk of chromosomal abnormality as a woman grows older, especially as they start getting older than 35 years of age. The statistics is this: if a lady is aged between 20 to 29 years old, her chances of having a miscarriage is just 12%. From age 29 to 34, it has increased to 25%. From age 35 to age 40, it has gone even higher, as high as 30%. From 40 to 45, you are looking at like 50% risk of having a miscarriage if one gets pregnant. And anything above 45 years old, you are looking at 93%. So you will see straight away from there that as a woman grows older, the risk of miscarriage increases. Other things in the maternal or in the mother that could increase miscarriage are lifestyle things. Increased alcohol results in miscarriage. A woman who takes a lot of cigarettes or smokes a lot has a higher chance of having a miscarriage. So that's as far as the epidemiological causes that has to do with age, with alcohol, or with smoking has to do. Is a particular problem called antiphospholipid antibody or antiphospholipid syndrome. Now, it is found that in about 15% of women who have recurrent miscarriage, they have these antiphospholipid antibodies in their system. And it is very important when one is doing investigation to check for these antibodies, because if it is found inside the woman, then it is easily treatable. The unfortunate thing is they are rarely checked for when one is investigating recurrent miscarriage. The antibodies to look out for are anti-lupus anticoagulant. Then we have one we call anticardiolipin antibody. One of the commonest one is polycystic ovarian syndrome. It's been found that women who have polycystic ovarian syndrome have about twice the risk of the normal population in having recurrent miscarriage. If we look at the uterus, which is carrying the fetus, what are the things that could be there that could be causing recurrent miscarriage? Sometimes some women are born with abnormal uterus. There are different types of uterus. There are some that we call biconate uterus. That is, the uterus has double horn. There are some that are called septate uterus. That is, there's something in between the uterus that divides the chamber of the uterus into two. All those things bring about recurrent miscarriage. And there are some women that have their cervix weak. We call it cervical incompetence. And this happens in such a way that if they do get pregnant, and as the pregnancy is growing older and older, sometimes in the second trimester, the cervix cannot support the weight of the pregnancy and it starts opening, and that results in miscarriage. Other things are infection. There are some certain types of infection that could bring about miscarriage, that is recurrent miscarriage. The typical type of infection we used to talk about in the past are called torch infection, T-O-R-C-H infection. And these are toxoplasmosis, rubella, syphilis, cytomegalovirus infection, and sometimes bacterial vaginosis infection. The important thing is to screen for all these infections and make sure they are not the ones causing the recurrent miscarriage. Any woman that has recurrent miscarriage should ideally be seen by an expert, either a gynecologist or a fertility expert, so that all these investigations can be done. And what are the investigations? If you are suspecting antiphospholipid antibody, you need to take blood investigations to check for those. If you are suspecting uterine abnormality, you need to do an ultrasound scan, which will easily show you what the uterus looks like. If you are suspecting an infection, or you detect an infection, all those touch infections, you need to have them treated before the next pregnancy. If it's a situation of age, if the woman is far gone in age, then you might be thinking about discussing issue of assisted conception with the woman. The treatment follows all the causes we've mentioned. In antiphospholipid antibody, the treatment, like I said, is very simple. Just using heparin and low-dose aspirin helps a sizable number of women. If a woman has antiphospholipid antibody and she doesn't know it, and she's having recurrent miscarriage, the chances that she will carry her own pregnancy is just about 10%. Whereas if she uses the heparin and the low-dose aspirin, that could increase her chance of carrying her own pregnancy to up to 56%. If it's a situation of uterine abnormality, there are surgeries that can be done. If it is abnormal uterus, they can be corrected. If it is fibroids that has distorted the inside of the womb, they can be removed. If it's an Asherman syndrome, it can be relieved. So the treatment is individualized. It depends on what is causing the problem. If it's a situation of thyroid or diabetes that are not well controlled, controlling those disease processes can result in a woman having her own pregnancy. That loving care can result in pregnancy in up to 75% of women who have recurrent pregnancy loss or recurrent miscarriage. Don't forget to like, share or comment on this page. And don't forget also, this is my book, How to Get Pregnant and Have a Baby. It's readily available on Amazon, and you can also get it on our website, www.stives.healthcare.com. Thank you for listening, and we'll see you the next time. Bye.